In the favelas of Sao Paolo, death is always close. But coronavirus is a different kind of killer, and it's spreading fast.
This is one of the poorest parts of this particular favela. Bon dia.
60 people live in this small compound. Cooking, washing, cleaning, everything is shared. A life of survival.
The watchwords of coronavirus have been social distancing, wash your hands, stay clean. In this world, it's basically impossible to do that. And they're doing what they can.
Amanda is 21 years old, and she's a new mother.
Well, how old is Elena?
1 month.
1 month? Wow.
It's bad, really bad. I can't go anywhere. It's not a good life at the moment. I'm afraid my daughter will contract the virus.
I wish this wasn't coronavirus because she looks so cute. I want to touch her face.
It's a difficult life, now made even harder.
Can I ask how many people here lost their jobs as a result of coronavirus? Wow. That's basically every adult here without an income. There's only one lady actually who still kept her job.
Latin America is now the epicenter of the coronavirus pandemic. Brazil's infections are rocketing, particularly among the poor. The country's had more than 500,000 reported cases, and the state of Sao Paolo, where over 1.5 million people live in these favelas, has been hit the hardest, with nearly 150,000 infections. But the reality may be much worse than what's being reported. President Jair Bolsonaro's government has limited the amount of information released to the public for the country's COVID-19 infections and deaths. Amanda does what she can to protect herself, but as ever for people who live this life, she's powerless.
Small children don't know how to deal with this. It's terrible. You try to remember to keep washing your hands, but sometimes you forget and you don't want to touch your baby. I don't know even why the government exists. They never do anything for anyone, and they never have.
The distrust between the government and the poor here runs deep. Those living in the favelas often turn to gangs. Many claim they're the only ones people can count on to get essential supplies and food. The gang that controls these streets gave us special access to their alternative state. It's called First Command of the Capital, PCC for short, and it's one of Brazil's largest and most lethal networks of organized crime. Marcelo, not his real name, runs the drug supply in a small section of this favela. This is a world not many get to see.
Business has been good. People always need drugs. It's an addiction. There's a strict hierarchy here. The bosses give orders from jail, and it comes down to me. People here get no help from the government. They need us. We are worried about coronavirus spreading.
They've issued rules to the community on how they must keep safe. I ask what happens if people break them.
I don't have the authority to tell you that.
This community centre provides some support.
I just want to show you in here, this is the kind of stuff that's being donated. These packs are waiting to go out, and in each one, people are given bleach, they're given antiseptic wash, soaps. You know, this just is the kind of stuff that people don't have the money to buy themselves, and it's all being donated by this organisation.
Locals tell us these groups work with the support of the gang that runs this favela.
The government is not helping people here, and that's where these gangs have filled the gap.
Benedicta lost her job. For 13 hours a day, she now makes masks that earn her around 20 cents a piece. The community centre distributes them.
All of these masks are distributed for free inside this community. We deliver masks every day. A lot of people don't want to wear the mask. You have people who listen to the government. President Bolsonaro said this was a little flu or media hysteria. A lot of people listen to this.
Showman President Bolsonaro has not taken the outbreak seriously, rarely appearing with a mask. We saw firsthand the anger from the young, the marginalized, protesters breaking out onto the streets, demonstrating against him, his authoritarian style, and his approach to the pandemic.
So we're just behind the police line here. They're trying to move forward to push protesters back. There's a lot of smoke and tear gas in the air.
All this is affecting the medical response.
The huge problem for us is this political and economical discussion and not seeing just the health situation. So we, as a healthcare worker, we know what you have to do, but our politicians are not involved. The population hear from our president, you can go out, you can go to the street, you have to work. And hear from the Sao Paolo government, no, you have to stay home, it's not time to go out.
So there's been a lot of mixed messaging.
So it's very confusing for the population.
A confused message for communities that need clarity the most.
The huge problem for us is the density of people that you have in these places. We don't have a space. Everyone lives together. We have one room for 7, 8 people, and people don't believe on the disease. People are used to violence. People are used to death. It's very sad for us to say something like that, but it's true. The problem for them is to earn some money to give food for their family. It's not to be infected.
Across town, the other Sao Paulo, the antithesis of what we've seen in the favelas. Modern residential buildings. People are whiter, wealthier in this part of town. But the same disease is spreading. Rosalie lost her mother, brother and uncle in the space of just 1 month. The family here were terrified of going to the hospital. Brazil's pandemic has spread badly among nurses. In fact, COVID has killed more nurses in Brazil than anywhere else.
Santa Maria, Mãe de Deus.
She prays for them every day, and she feels guilty.
My mother didn't want to go to the hospital. She was afraid she'd die like my uncle. She didn't want to be intubated. It was my brother who told me. He said to me, "Rosie, Mom just died." I said, "No, I don't believe you." It felt like the ground opened under my feet.
The economic impact on this city has been devastating. Downtown Sao Paulo now a dystopian vision of poverty. Patrick had a job as a security guard, but now he lines up with the homeless and drug addicted to get food. Look at his eyes. You can see the anger.
I feel humiliated to have come here. Before we had a good government, they were helping and supporting people, but now it feels like this government is against us.
In this divided city, it's only at the Formosa Cemetery where rich and poor unite. Vultures welcome the dead. Hundreds are being buried here every day. The Raciano family is here for Josemar, who died just the day before. He was 50.
It's a strange contrast. Men in PPE, and then these very elaborate flowers for each grave. Each of these funerals can only last a few minutes before the family is moved away.
His wife is unconsolable. Brother-in-law Georgie agrees to speak to us.
It's so difficult to find the words. He had a huge heart. He was a son, a father, a grandfather, a husband. He was a sensational person.
This is one family among hundreds. They arrive one after the other for their quick goodbyes. And there may be a lot more to come.
We are in the peak, and we are going to stay in the peak. It's not going to decrease in the next weeks. I think we are still around 1,000 deaths per day in our country. It's a huge number, huge numbers.
Brazil has already suffered so much, and now it's preparing for worse.
James Longman, ABC News, Sao Paulo.